The last government, after a lot of, let's say, encouragement, designated Athlone as a major growth centre under Project Ireland 2040, and it's expected to become a regional city over time. Now, this government have already seen a reduction in the public transport connectivity between the local towns within its catchment and the town of Athlone itself, with the withdrawal of the Bus Éireann Route 20 service, just as the town secures university status. So where is the joined-up thinking?
Deputy Minister.
Deputy, there has been a substantial increase in funding for local link services since 2016, going from 12.2 million in 2016 to 28 million in 2021, comprising the RTP current and capital funding, COVID-related funding and PSO funding for rural regular services. The additional funding since 2016 has enabled the introduction of 85 new rural regular service routes, as well as improvements to DRT services and the piloting of evening nighttime services in certain rural areas which have been mainstreamed. The new rural regular services operate at least 5 times per day over 5, 6 and 7 days per week schedule. They are specifically designed to ensure connectivity with other public transport services and better linkages of services between towns and villages. Bus Éireann operates a substantial PSO business under contract with the NTA, providing subvented bus services outside Dublin and in regional and rural locations throughout the country. It also has a separate commercially run business, Expressway, which operates a number of inter-regional bus routes. The COVID-19 health emergency brought a profound and swift shock to the public transport sector. Public transport's designation as an essential service throughout the pandemic means that though fare revenues have collapsed, most of the shortfall has been met by government to meet the broader policy objectives. We spent in 2020 over 620 million in support of those PSO services. For 2021, over 670 million has been provided in funding to ensure that the existing level of services were kept. By comparison, the level of PSO and local link funding in 2019 was in the region of 300 million. Further, in June 2020, the government decided to introduce new temporary financial support for certain licensed services provided by commercial operators to ensure the continued operation of these essential services. That was the key joint-up thinking in terms of maintaining and developing and broadening out public transport services for all parts of our country. As I said to Deputy O'Rourke earlier, we have to make sure that we meet the needs of every different community and balance that funding across the country as we best can.
Deputy Naughten.
Minister, the hospital for the town of Athlone is Portiuncula Hospital in Ballinasloe. There's been a 60% reduction in the number of buses facilitating patients and visitors attending Portiuncula as a result of the decision by the National Transport Authority not to replace the lost Bus Éireann services. An analysis of the current CityLink replacement service with that provided by Bus Éireann shows that between 7:30 in the morning and 9:30 at night, we've gone from 226 buses a week to the current offering of just 84 buses a week outside Portiuncula. And there's now a different bus stop, pick-up point and drop-off point in the town of Athlone for the connection services to the local hospital in Ballinasloe and the other regional services that are actually stopped via Bus Éireann at Southern Station in Athlone, the bus station. So we've 2 different pick-up points now in the town of Athlone. And if you have an appointment, Minister, in Ballinasloe and you have to travel from Athlone and the appointment is at 11 a.m, you have to get the bus at 9 o'clock and spend an hour and a half waiting in Ballinasloe before your appointment.
Minister.
Deputy, you make a valid point. I've met with local representatives of the area and I had a series of discussions with my own officials to address or to try and address the concerns, and said to them that we do need to look again at the very specific issue in terms of Portiuncula Hospital and making sure that the local link services as we adapt here, and we are changing the overall route alignment, that we do have to make sure that we do maintain critical connectivity to facilities such as that. The NTA, as I recall, are charged with working with the local operators and with Bus Éireann and others to make sure that we do address some of the concerns that have been raised. I'll have to come back to I'll have to ask the department for an update because it wasn't specifically asked for in the written question, but come back with an update in that regard. It's something we're very aware of and have been working on.
Deputy.
And I welcome your comments in relation to that. Just, Minister, to put it on the record, we're now going to see a development of health services in Portiuncula with the development of a new ambulatory care centre there, which will expand the outpatient services available in Portiuncula. Now, if you're going from Roscommon Town to Portiuncula for one of those appointments, and let's say you have an appointment for 11 a.m. In Portiuncula, you would have to leave Roscommon Town before 6 o'clock in the morning. It would take you 4 hours to get the service, to get to Ballinasloe, travelling from Roscommon Town into Galway City to the Cathedral, then walk a kilometre over to the main bus station, then get the Cork service to Ordenmore, and then get a connection from Ordenmore to Ballinasloe. Now, there is a bus service going from Westport, Castlebar, Roscommon, and terminates in Athlone. If that terminated in Ballinasloe, you'd connect 3 hospitals together and organise the appointments around that.
Conclude, Minister.
No, you make a good point, and I think there's a new strategy we're looking at, Connecting Ireland, which is looking at the development of rural bus transport systems. And critically, I think one of the efficiencies we want to get is to connect some of our health, a lot of the transport needs we have to health facilities into that system, and look at a variety of different solutions and options. We're going to have to be creative and connect up our health and transport needs with our general public transport needs. And Portiuncula could be one example of that as we make the amendments we're going to need to make.